I'm Kim Baldock-Mullock. I'm the pediatric audiologist at Parker Hearing, and I'm going to talk to you a little bit today about what to expect when you come in for your child's hearing test. Depending on your child's age, that really dictates to the audiologist what type of behavioral testing we're going to use with your child. If your child is 6 months and under, we typically do what's called impedance. We're just looking at the movement of the child's eardrum to make sure there's no fluid or infection or something anatomically wrong with the middle ear bones or the eardrum. That is going to give us a lot of information about whether or not the child is capable of hearing and what type of hearing loss they may have if there is a hearing loss. The other thing we're going to do with someone 6 months and under is called Otoacoustic Emissions. Basically what that is we create a tone that we put into the child's ear, and we're looking at the function of the outer hair cells of the ear. If the child has normal functioning outer hair cells, the ear is going to create an echo that will come back and we will be able to measure. It's a nice test to be able to do on infants that can't really subjectively give us a response and say, yes, I hear that sound. When your child is over 6 months, then they typically are a little bit more prone to be able to test in the booth. What we do in the booth is called visual reinforcement audiometry. So we put a tone through a speaker. When the child conditions to turn to that tone, we light up a toy to reinforce that behavior. And then we can kind of cycle through the frequencies. Mainly we're looking at the speech frequencies to determine whether or not those sounds are audible for the child. When the child is a little bit older, usually about 3, then we can do what's called play audiometry. And basically what we do is we put headphones on the child, we produce tones. When the child hears the tone, they throw a block into a bucket or some type of toy, and that is how they signal to us that they hear the sound. So that's what you can expect today as far as the testing. When we're through with the testing, the audiologist will go over the details with you and tell you what the recommendations are.